We know that pregnant women who develop symptomatic COVID have a higher risk of certain complications in pregnancy, particularly preterm birth. They have a higher risk of having a cesarean section during their pregnancy. They have an increased risk of being hospitalized in an ICU and requiring mechanical ventilation. They also have an increased risk of dying, particularly in the third trimester. So it's important that we try and give these women some protection before becoming pregnant. And the only protection we have at the moment is the vaccine. By vaccinating, we'll reduce the risk of morbidity and severe morbidity. We'll reduce the risk for hospitalization. We hope to reduce the risk of stillbirth, preterm birth, and other complications associated with hospitalization. So although vaccine does reduce your risk for infection, there's a significant reduction in risk for severe morbidity, hospitalization, mechanical ventilation, and even death. If the mother gets a vaccine prior or during pregnancy, her antibodies will then be transferred across the placenta into the umbilical cord, and we have this transplacental transfer of antibodies to the fetus in utero. So the fetus gets antibodies from the mother, additional antibodies are transferred during breastfeeding, and the infant is then protected at birth. We've got good experience with vaccination in pregnancy, particularly with the tetanus vaccination, which is a recommended vaccine in pregnancy. And neonatal tetanus has been now eradicated in most high-income countries, but also in our low and middle-income countries. Rates have come down significantly since the introduction of tetanus vaccination in pregnancy, and that is the rationale behind vaccination.